Hi everyone, I am Dr. Siddharth Sen from the Faculty of Physiotherapy. Welcome you all in this e-learning platform of SGT University. Today I will discuss about the ankle injuries, specifically the ankle sprain. As you all know, the ankle injury is very common conditions in day-to-day life. Even we are seeing the maximum number of cases of this type of injuries. About 2 to 3% of all injuries are ankle sprain. Now I'll discuss the rehabilitation of the ankle sprain. The rehabilitation was done in 4 phases: acute phase, subacute phase, chronic phase, and return to activity phase. So let us discuss the acute phase. The duration of the acute phase in grade 1 is usually 1 to 3 days. For grade 2, it is 2 to 4 days. For grade 3, it is 3 to 7 days. The goals of the rehabilitation in acute phase is usually number 1, decrease swelling, number 2, decrease pain, number 3, protection from the re-injuries, number 4, maintenance or appropriate weight bearing status. First, protection. Protection is done by the tapping technique, the rigid tapping technique we can apply, functional bracing we can apply, and thirdly, rest. During rest, we can use the crutch to promote the ambulation without any gait deviation. Next, icing can be done by the use of the ice packs or cryotherapy. We can use the light compression which can be applied using the elastic wrap or vaso-pneumatic pump. The elevation can be done by elevate the ankle, and it can be elevated above the heart level and can be done along with the ankle pump. Next, I'll discuss the subacute phase. The duration of the subacute phase for grade 1 ankle injuries is 2 to 4 days. For grade 2 ankle injuries, 3 to 5 days. For grade 3 ankle injuries, it is 4 to 8 days. The goals of the acute phase is basically decrease swelling, decrease pain, increase pain-free range of motion, beginning strengthening exercises, begin non-weight bearing proprioceptive training, and lastly, provide the protective support as needed. Now we can use the modality to decrease the pain and swelling. For that, we can apply ice or the contrast bath. We can apply electrical stimulation, specifically high voltage pulsed galvanic stimulation or interferential current. We can apply ultrasound also and cross friction massage. Progression to the weight bearing status. As the symptoms permitted, we can initiate the partial weight bearing to full weight bearing if there is no signs of antalgic gait are present. Now I'll demonstrate the ankle range of motion exercise. He is Parvinder, my patient. I'll demonstrate each of the ankle exercise, and every exercise has to perform 10 repetitions. First exercise is ankle dorsiflexion. So from neutral position to upward. Second is plantar flexion, from neutral position to downward. third, inversion from neutral position to medially and upward. And last is eversion, that is laterally and upward. So all the exercise will increase the range of motion in and around the ankle joint after ankle sprain. Now I will demonstrate the ankle isometric exercise. Isometric exercise will perform in a particular movement, or we hold the movement in that particular position so that there is no gross movement. To strengthen the dorsiflexor muscles, I'll make the foot into dorsiflexion position and ask him to pull that thing. Similarly for plantar flexion, move down, push down, niche ki taraf. Good. So this is the isometric for plantar flexion, and medially. So this is for inversion and laterally. Now I'll demonstrate the towel rolling exercise. For that, I'll place my foot over the towel and ask him to hold the towel this way. Now I'll do the pick up exercise with the using of the intrinsic muscles. Now I'll pick up the objects and put it into the plate. Next is heel raise exercise. This way, do the 10 repetitions. Then toe raise exercise, do the 10 repetitions. Next is BAPS board exercise to increase the proprioception of the ankle joint. First I'll place the foot in the central of the BAPS board and I'll push it anteriorly and posteriorly. For plantar flexion anteriorly and dorsiflexion posteriorly. And for eversion medially and inversion laterally. And this exercise I'll do in 10 repetitions. For the mobilization of the ankle joint, we'll do grade 1 and 2 for ankle sprain. So I'll hold the ankle in this position specifically for the PA glide. And for grade 2, I'll apply little more pressure. Now I'll discuss the chronic phase. The duration of chronic phase for grade 1 ankle sprain is 1 week. For grade 2, it is 2 weeks. For grade 3, it is 3 weeks. The goals for phase 3 is to increase the pain-free range of motion. We can progress the strengthening phase. We can progress the proprioceptive training, increase pain-free activities of daily living, and pain-free full weight bearing and uncompensated gait. To achieve this, we can do the therapeutic exercise, strengthening exercises, eccentric and concentric exercises. Now I'll demonstrate the strengthening exercise with the TheraBand. I'll place the TheraBand over the ball of the toe and the other end of the TheraBand I'll hold it and I'll do the plantar flexion. And for eversion, I'll place the foot in this way crosswise and I'll do this eversion. This is the eversion exercise. Similarly, for inversion exercise, I'll place my foot this way and I'll do this. For the dorsiflexion, I'll tie the TheraBand with the plinth and I'll do the dorsiflexion. Next is step up exercise. I'll place my foot like this way. Semi squat exercise. Next is the balance with single leg stance, and same I'll do the forward and backward, medial and lateral. The last phase of the rehabilitation is the return to activity. The duration of this phase for grade 1 injuries is 1 to 2 weeks, for grade 2, 2 to 3 weeks, and for grade 3, it is 3 to 6 weeks. The goals of this phase is to regain the full strength, normal biomechanics, return to the proprioception, and lastly, protection and strengthening exercise. To achieve this goal, we can do the therapeutic exercise as a continuous progression of range of motion and strengthening exercise. We can do the sport-specific strengthening exercise. The running progression can be done with the loaded jogging, alternate jogging, walking, jogging, or alternate sprinting, jogging, sprinting. We can do the jogging in figure of 8 pattern or in zigzag cutting. We can use the agility drill. During the agility drill, we can use the back stepping and side stepping process, and lastly, the plyometric exercise to the specific sports activity. I hope you all have understand the today's topic. Thank you so much for watching my video. Till then, bye bye, stay healthy.